Oh, that might be easier, actually.
But now we lost her again.
Yeah.
Well, I had to go turn the lights on.
Oh, there you go.
I don't have the clap on, Dan, for my lights.
We'll get Louis to do it.
He's too busy getting his coffee and listening to me bitch about Zoom.
Right,
All right, I'm ready.
We're being
Coffee. Good to go. I lost my pen.
All right, Nancy, you know, you're on record. You're being recorded now, just so you know.
Okay. Well, I'm sure no one would be surprised by my language. So. All right, we're ready.
All right, guys, are we ready? Can we start?
Yeah.
You ready to start? Okay, awesome. So welcome to the March 30th Public Board of Health meeting in Southborough. And we're going to bring the meeting to order. I have to read this virtual meeting
Grab a pen.
book. It is pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of open meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Southborough Board of Health will be conducted via remote guidelines for remote participation by members of the public and or parties with the right and or requirement to attend the meeting can be found at Southborough's website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner by finding the meeting at Southborough / it says on this remote meetings, but it says virtual meetings on our website. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technology means. In the event that we are unable to do so, despite best efforts, we will post on the Southborough website an audio and or video recording, transcript, and other comprehensive records of the proceedings as soon as possible after the meeting. Welcome.
Welcome.
Okay, guys, we have a busy meeting today. Probably, a really important and a lot of votes that we have to get through today. I was hoping that Dr. Heather could give us a little update on the coronavirus front, kind of before we dive into the meeting itself. What's going on in Southborough and sort of where we're at and what do you see going forward?
All right. Good morning. We are, for the town numbers, as of Sunday, we're at 445 confirmed cases of coronavirus in the town and 3 deaths. We are tracking the numbers. Every week, the state puts out sort of a 2-week total for numbers, and we really peaked high in January and into February, and then we came down. And unfortunately, we're on an upswing again. 2 weeks ago, then the 2-week number was 14. Then the week after it was 19, and last week it was 24. And I think this week, again, it'll be in the 20s. So we're unfortunately seeing, after a few weeks ago where we saw a decline from that January peak, we're seeing an uptick again. We certainly have cases in both boarding schools right now, daycare, and so some of this is among the teens and 20-year-olds, but it's still across all age groups currently in Southborough. So we're having a little uptick there. We are also following the numbers for Southborough residents who are vaccinated, and we that state published data again is every Thursday. So this is as of last Thursday. We had 34% of our Southborough residents had received at least 1 dose of vaccine. So that's very good. And our seniors, our age group 75 plus, where we really took the time, thanks to Emily, and made outreach to them and worked with the Hopkinton Clinic and worked with homebounds. The 75-year-olds, 86% have received at least one dose. So it's a huge number, a huge
Watch the cat.
percentage, I think higher than other towns. And 71% are fully vaccinated. And so that was of last week, Thursday. So I'm sure by this week it's up a couple more percent. So we really did that outreach, assisted also by the senior center to be able to, with the Hopkinton Regional Clinic, get them to the word out and get them to Hopkinton for vaccination. We also did with Emily's lead a Google form, with Emily's lead homebound vaccination. So we really covered that population very well. We have the senior housing at Colonial Gardens. We did the first vaccine clinic on March 5th. And with no shows and extra pulled doses, we pulled in a couple more 75-year-olds there. And then we have second dose for that April 5th coming up for the second dose for Colonial Gardens. So that's our local Southborough update. I mean, I also have updates on the regional clinic and on shared service, but that's the coronavirus here in Southborough. And
Awesome.
it's
I'm a
again,
great
like it's
guys.
coming up again. So we'll see where that goes, but.
Yeah, that's so so great. Emily, I know you sort of put in a big push, even though you were going to leave at the end, and the residents of Southborough should be enormously grateful to, you know, you going. I don't think they realized that you guys actually went to homes of people that were homebound and vaccinated them. Went over to Colonial Gardens and did a vaccination clinic over there in their space. And that's really why we're at the numbers that we are for the 75 and over. So thank you for doing that. I know, Emily, you can't be on too long. So, and I want to talk about the regional vaccine clinic, but can you share any thoughts on, you know, right now we don't have public health nursing. We have the 2 per diem nurses that are kind of helping out. And as I've been talking with residents in town and really sharing some of the challenges that we've had at the health department and the need for the budget to go forward, I realized that, you know, there are many people in town and decision makers who don't understand what public health nursing does in the health department and why we need nursing help. And so I'm wondering if you can share like some of the work that you've done and the time that you've put in, and now you're also help out in Sudbury. And so you can give some sort of correlation to Southborough. I think that would be really helpful for people to understand. And Taylor, who's going to be coming into that role, so she will understand as well.
So the role of a public health nurse can vary year to year, as we know. We change with what the needs are of the town and the residents. And I think it's important to have a nurse in the role because nurses are educated and trained in order to be able to adapt to situations and adapt to different populations of people and individual situations. I recently spoke at my alma mater at UMass to some graduating nurses and addressed, you know, the concerns that they were having about going into the workforce and not having their clinical rotations, as many clinical rotations as in a typical year. And I talked to them a lot about being a nurse is a way of thinking and developing skill sets without actually learning how to put an IV in, because like doing a specific skill like that can vary from hospital to hospital and unit to unit. So it's the ability to be able to learn those skills and be able to ask the appropriate questions of the person or the population or the situation that you're in order to adapt your way of thinking to be able to educate your patients, your community, etc. So I think that epitomizes what a public health nurse does, because you're constantly adapting to what the needs are, not just of a large group, but with each individual family or person you come in contact with. So without having anything prepared here, I think being a public health nurse, you go to these education sessions, whether it's on Triple E or tick-borne illnesses or any kind of communicable disease, and then being able to bring that back to your community and educate your community. And I think what's lacking in Southborough compared to, for Sudbury, for example, where I've worked for the last couple of years, and I live in Sudbury too. So, I'm very proud of my community, is that they have a lot of outreach. So in Southborough, we're really lacking that outward facing piece, like getting up on social media from the Board of Health, and just outreach in general. I think I really wish that I had the time in the last year to be proactive with COVID education. And there wasn't really a channel to do that, like already built in. So with all the other responsibilities that I was taking care of, it was impossible to then develop a whole new system. So I think if you have a way of communicating to the community in place, you can adapt that to whatever the needs are. So, whether that's flu in the early fall or in the spring and summer, educating on protecting yourself from tick-borne illnesses. There's numerous things. And I think that there are needs in the community that we can build on by bringing in other groups like Youth and Family Services, like really working with them to help, the mental health of the community. I think that is going to be an even more important aspect of community outreach. In working in Sudbury, we actually have a team of 6 nurses right now, and it's been really great to be able to offer that service to the community and really do a lot of one-on-one with isolation and quarantine. And I really try to uphold that standard in Southborough, because to me, that's how I want to provide care to the community. But it's just really been a challenge. So
A challenge because of the time constraints.
correct.
Yeah.
Without the staffing. for
Staffing.
sure. Mhm.
Okay.
And
Emily, can you
sometimes
talk
Yep, go
talk
ahead.
a little bit about some of the other things that are non-COVID related that public health, like the Sudbury, when you were at Sudbury before COVID, like what were some of the things that the nurses did that we could and should be doing in Southborough?
We did a lot of outreach with the schools. I know we did some presentations on vaping with the high school, and I know in the fall previous to COVID, there was a lot of education in regards to Triple E, because that was there was an outbreak of that. So we went and spoke with all the elementary schools. There was a large group of people in town who met regularly to determine, what was happening with youth sports. And I know that happened in Southborough as well. But I feel like it was a lot of, there's already a system in place in Sudbury, whereas in Southborough it was kind of like, okay, we'll rush and get everything together,
It was more reactive than proactive, right? It was more,
exactly.
And I think that's the intent of our new staffing structure and plan, is so that we can have a core structure and a core a base of staffing and hours of staffing that will allow us to react when we need to react. But unless we're proactive in setting that up, when an issue happens, as we just witnessed in the last year, we're not prepared. I've sort of relayed this at one of the other meetings. It's like we were operating pre-COVID, like we were in a rowboat going up a river with one paddle. And then we got a leak in the boat. COVID had put a leak in our boat and we can't go anywhere. We're sinking. And, so I think we need to get ourselves on a rowboat with two paddles and maybe even prepare ourselves to have an engine if we need one. And that's the direction I'm trying to move us. And we need to relay to the residents that need so that we can be prepared when something happens. And I appreciate all the time. I know you came on at halftime. Thanks for joining us today to just sort of give a little bit of background of, what you went through. And I didn't know if you wanted to give any thoughts as we move forward into this sort of new plan of sort of getting a new structure before you got off.
Yeah, I feel like, with COVID, it's just so hard to escape that. It was, I'm running on empty, and it's, it feels like it's getting worse again. But when I was in Sudbury and just working part-time there, under the direction of their lead public health nurse, we were able to vaccinate individuals for flu in large numbers, and really doing a lot of outreach within the schools and getting, the teachers and both the students to be involved. And it was all, a very organized process. We have in Southborough, we've done a great job with the senior community and had really great clinics, but I do feel that could be expanded. This year we put together one clinic directly for the schools, and then another small one later in December. But the community was so appreciative of that. And I think that, moving forward, especially if we're going to have more vaccinations on an annual basis, we really need to have a more sound structure and be able to reach more community members. So.
Thanks. Thank you
Thank you.
for your dedication and your commitment to work over the hours, and thank your family for letting you do that. We appreciate it. Heather, do you want to give everybody an update on the vaccine clinic? Because that's exciting. And I know a lot of people in town were excited about us participating in that. But I don't think a lot of people don't know what that entailed, being part of that regional, just getting set up. If you can kind of give an overview of the work that you've had to put in to kind of set that regional vaccine clinic up, and then what it's going to look like going forward.
Yep. Nancy, did you have a question or no?
No.
No. Okay. Your hand's raised.
Oh, I didn't.
We, back when, in, February, what Emily was still here, we were approached by the town of Hopkinton, local boards of health, per the MDPH, as we've been going forward this, since January, is not favoring vaccine being sent to local boards of health. So they're sort of favoring mass vaccination sites. So for local boards of health, they're at this point only considering sort of regional applications, so more than one town. So Hopkinton approached us. They were getting a Pfizer shipment, and that's over 1,000 doses. And only 75-year-olds were eligible. So it wasn't, and medical first responders. So there wasn't, they started it luckily, and invited us, and had, I believe, 5 towns in the end partake in that. And so we've done both first and second dose for that. And then when that was wrapping up, we were again looking at doing another regional application because the local towns basically are not going to get vaccine. And luckily, Northborough took the lead as a full-time agent, and we worked with 7 towns. We kind of went off the list from the Westboro Clinic initially for the first responders before I came. There was towns pulled together to hold the first responders vaccination clinic before I was here. So we talked with all those towns. One of them dropped out, but we got 1 or 2 other ones as well. So we kind of worked through the towns who were interested in applying regionally, because at that point, that gives you your best opportunity to get vaccine on the local level. So we, 7 towns, the health agents, the fire chiefs, but the health agents in particular met with Jana Ferguson about, our getting a regional vaccine, how likely that was, telling us that to hold a regional vaccine clinic, you're going to be a state site. You're going to be open to everyone in the state. You may never, at that point, the assistant commissioner said, you may never vaccinate your own